Hello.
Yes, sir.
Okay, thank you, thank you. Uh, can I start?
Yes, sir.
Thank you, sir. Most of all, welcome to this lecture, Extraocular Muscles of the Eye. Me, Dr. Ismail, Professor, NIONH, Bangalore, Dhaka. Today's lecture on the basis of collected from the Fancy, along with the American Academy, Old Anatomy, Nima, one type of anatomy lecture, Indian books, 40 books, and with the Washa, Professor Samsul Haq, Professor Ismail, and our respected teacher, my mentor, Professor Ghulam Haidar sir. Okay, thank you. Most of welcome. Today's lecture is the extraocular muscles of eye. Yeah, Paula, হচ্ছে একটু থাকুন শুরুটা করে নিই তারপরে our introduction little bit talks about the orbital muscle. There is two types of muscle. Uh, there is the extrinsic muscle and the intrinsic muscle. Both muscles are responsible for the different activities. Extrinsic muscle, that is the extraocular muscles are located within the orbit, but are extrinsic গরম লাগছে হ্যাঁ শুধু ছোটটা extraocular muscles are located within the orbit but are extrinsic and separate from the eyeball itself. শোনা যায়? They act to control the movements of the eyeball. There are four recti, two oblique, and LPS muscle, that is levator palpebrae superioris. An intrinsic muscle of the eyeball and they control the shape of the lens and size of the pupil. This is the intraocular muscles. Another types, functionally, they can divide it into two groups, responsible for the eye movements and responsible for the superior eye movements. That is, responsible for the eye movements of the recti muscle and oblique muscle. For the responsible for the upper eyelid movements. And the extraocular muscles also in the voluntary muscles and involuntary muscles. Voluntary are the four recti and two obliques and LPS muscle. And involuntary is the superior tarsal muscle. This is the deeper part of the levator palpebrae superioris, which are the responsible for the Horner syndrome, and inferior tarsal muscle, and orbicularis ocular muscle. These are the types of the extraocular muscles. And these are the muscles in scenario shape. এখানে দেখো আমাদের মাসেলের লেয়ার গুলো আমি দেখিয়েছি this is the superior oblique muscle সবার উপরে দেখিয়েছি এবং superior oblique পলি and LPS muscle, this is the LPS muscle just লিডে গিয়ে শেষ হয়েছে and superior rectus muscle, this is the superior rectus in relation to this LPS muscle and the superior oblique muscle as well as in the lead muscle and this is the medial rectus muscle and inferiorly that is the lateral rectus muscle and inferior rectus muscle, inferior oblique muscle. All muscles are supplied by the oculomotor nerve, except lateral rectus and superior oblique. It's a theory known everybody. And this is the আমরা বলবো sagittal feature, and this is the বলবো coronal feature. Like this way, যদি আমরা চিন্তা করি তাহলে এখানে মাসেল গুলো আমি দেখিয়েছি. This is the lateral rectus muscle, and this is the superior oblique muscle, trochlea, this is the levator muscle, and this is the optic nerve, and inferior rectus muscle, and inferior oblique muscle. And like this way, this figure also known the medial rectus, lateral rectus, and the superior rectus, and the superior oblique muscle also. This one. Now, a little bit about the another structure which are responsible for the movement of the eyeball and the sling of the eyeball. This is the cheek ligament. Cheek ligament are the facial specialization in the orbit. These are the expansion of the investigating fascia covering the medial and lateral rectus muscle, which are attached to the medial lateral walls of the orbit. And this is the medial cheek ligament, and this is the lateral cheek ligament. And these cheek ligaments are extension from the fascia covering the medial rectus muscle and attached immediately posterior to the posterior lacrimal crest and lacrimal bone. And this is the medial rectus muscle, this is the lateral rectus muscle. These are the figures, and this is the eyeball. And later on, you see another picture, and this is the fascial expansion. And this is the fascial expansion, and this is the fascial expansion is the white arrow, triangular in shape. This one, the fascial expansion, and this is the cone place. Previously, we said in the orbit lecture. Lateral cheek ligament is an extension from the fascia covering the lateral rectus muscle, as well as attached to the orbital tubercle of the zygomatic bone. Functionally, the position of this ligament seems to restrict the medial and lateral rectus muscle. That names the fascial specialization and does maintain the proper position of the eyeball within the orbit. Now, suspensory ligaments. Those two topics, cheek ligaments and suspensory ligaments, sometimes written in short note in diploma course. Lower part of the canons, and this is the round the circle. Okay, this round the circle below the equator and along with equator. And this round circle is the suspensory ligament, which is formed by the lower part of the canons capsules or fascia sheath of the eyeball, thicken and name the suspensory ligament of the eye or the suspensory ligament of the lobe wood that supports the eyeball. It is the sling-like hammock below the eyeball. It is formed by union of the margin of the fascial sheath of the inferior rectus and inferior oblique muscle. And this is the inferior rectus muscle and inferior oblique muscle. And these two muscles are the margin, the fascial sheath margin. These are the sheath of the inferior rectus and the inferior oblique muscle. Inferior oblique muscle, medial and lateral cheek ligaments. চেক লিগামেন্টের সাথে এটা অ্যাটাচড হয়ে যায়, যার জন্য এটা আমাদের আইবলের নামকের সাথে কাজ করে। Now, going to our topics, the orbital muscles. The recti, it is derived from the Latin word. Latin means straight. From this, there is a recti muscle direct from origin to the attachment. This figure previously shown. This is the oblique muscle, and this is the muscle pulley, that is trochlea. And these are the superior rectus muscle, and below is the medial rectus, lateral rectus, inferior rectus, and inferior oblique muscle. And this is the floor, and this is the row, and this is the equator. Remember it, There is two muscles, oblique muscle below the equator and other four muscles there is the anterior to the equator. We know the contrast with the oblique muscle, he has a very angular approach to the eyeball. There is seven extraocular muscles, four recti, two oblique, and alveolus muscle. And this is the annulus of Zinn in the apex of the orbit. You remember all of this anatomy. Okay. Annulus of Zinn. What is annulus of Zinn? The four recti muscles arises from the short funnel-shaped tendinous ring called annulus of Zinn. It's a question of MCQ. What type or what is the shape of the annulus of Zinn? It is funnel shape. Remember. The annulus of Zinn encloses the optic foramen. Optic foramen lies in the lesser ring of the sphenoid bone. We discussed previously in the orbit chapter. Uh, Part of the medial end of the superior orbital fissure. There are two tendons. There is a tendon of the lower jaw and tendon of the upper jaw. It's attached to the inferior root of the lesser ring of the sphenoid bone between the optic foramen and the superior orbital fissure. The lower tendon gives the origin part of the medial lateral rectus and all of the inferior rectus shown downwards later on arises from the body of the sphenoid bone and gives origin to the part of the medial and lateral rectus and all of the superior rectus. The superior and medial recti muscle are much more closely related to the dorsal sheath of the optic nerve. This is important for responsible characteristic pain or movement in case of retroorbital neuritis. Remember, it's the question of MCQ. Now, annulus of Zinn, we see the four recti muscle. Okay, and the four recti muscle arises from the short funnel shaped annulus. Previously said the annulus of Zinn includes the optic foramen and part of the medial end of the superior orbital fissure. This is the superior orbital fissure. বলেছি যে এই যে posterior pole টা থাকে দুটো optic foramen, optic channel and এই optic foramen থাকছে optic nerve coverage and a part of the superior orbital fissure. There are two tendons, lower tendon of Zinn বলেছি কোথায় থাকে and lower tendon gives the origin of the part of the medial and lateral rectus. Part of the medial and lateral rectus is the lateral rectus and medial rectus are part and whole of the inferior rectus. তাহলে কি হলো উপরের টাকায় কি হবে, একটু লোয়ার টেন্ডন যদি হয় তাহলে আপারটা যাবে কি আপার টেন্ডন দিয়ে পুরোটা যাচ্ছে তার মানে কি part of the lateral rectus, part of the medial rectus and superior rectus. All of the superior rectus arises from the upper part. তাহলে inferior rectus origin নিচ্ছে lower part of the tendon থেকে আর superior rectus tendon নিচ্ছে upper part of the tendon. কিন্তু both tendon থেকে origin নিচ্ছে medial rectus and lateral rectus. This is the question of MCQ in first part 1. Annulus of Zinn. Remember it. This is the figure of configuration. All muscles previously shown which muscle what of it is, and this is the nerve. Ocular motor nerve. This is the upper division. This is the lower division. Okay. From the rectus muscle origin, we see the anterior to the optic foramen. It arises from the common tendinous ring of the connective tissue. This is the annulus of Zinn. Annulus of Zinn is one type of specialized connective tissue. And it is funnel shaped, like the posterior pole around the optic foramen. Remember, it forms anterior to the optic foramen and forms a muscle core. And this is the picture to show four recti over here. It's the superior orbital fissure and inferior orbital fissure. And superior orbital fissure, two parts, upper part and lower part. the another picture. Supraorbital fissure. Supraorbital fissure. Previously, we shown in the orbital chapter, and this is the muscle around the part of the supraorbital fissure and optic foramen. This is the optic channel contains optic nerve coverts and superior optic channel. These are the muscles. 4 muscles. If you remember this figure, then you will show that it's short note in space, MS, written examination. Now, another picture. The spiral of talus. What is spiral of talus? It is very important for the strategy. The spiral of talus is an imaginary line joining the insertion of the 4 recti muscle in relation to the limb. And this is the insertion. It is an important landmark when performed surgery. The insertion are located progressively further away from the limbus using a spiral pattern. Average values are remembered. Medial rectus 5.5 from the limbus to the insertion at the equator, in front of the anterior to the equator. Remember it, anterior to the equator. 5.5 millimeter, 6.5 millimeter, 6.9 millimeter, and 7.7 millimeter. And now our 4 recti muscle, one of these is the superior rectus. Superior rectus muscle, this is the superior rectus muscle. This one inserted, this is the limbus from here, from 7.7 millimeter. Arises from the upper part of the annulus of Zinn. Annulus of Zinn upper part থেকে নিচ্ছে, and to the lateral side of the optic foramen from the sheath of the optic nerve. Optic nerve যে sheath আছে এর কোথা থেকে নিচ্ছে আমরা বলেছি superior orbital upper part of the tendon থেকে fully নিচ্ছে and lateral side of the optic foramen থেকে নিচ্ছে. Optic foramen কে আমরা যে 4 ভাগে ভাগ করি, upper, lower, medial and lateral. এটা lateral side থেকে নিচ্ছে. Remember it. Superior rectus arises from the lateral part of the optic foramen from the sheath of the optic nerve. This origin lies below that of the levator and is continuous with the medial side of the medial rectus and lateral rectus muscle. Okay. Insertion দিচ্ছে কোথায় বলছি আমরা? Blood supply দিচ্ছে ophthalmic artery, যে lateral muscular part এটা আছে। এটা টোটাল কত সাইজ লম্বা? আমরা বলবো এটা 42 মিলিমিটার লম্বা। এখানে তাহলে ক্যান্ডনটা কতটুকু আছে? ক্যান্ডন আছে 5.5 মিলিমিটার। ক্যান্ডন আছে 5.8 মিলিমিটার। Okay, and it is wide 10.8 millimeters. This is the question for capsules. Now relation, it is superior LPS muscle. Okay. This is the LPS muscle. This is the superior rectus muscle. And this is superior rectus muscle. This one. Original. Now, উপরে কে থাকছে তাহলে superior rectus muscle, frontal nerve, which separate it from the roof of the orbit. Roof of the orbit থেকে এই দুটো মাসল দিয়ে superior rectus সেপারেট থাকে। superior. আর ইনফ্রন্টলি কি হবে তাহলে? optic nerve থাকছে নিচের দিকে, but separated by orbital tract. নিচের দিকে orbital tract থেকে সেপারেট থাকে। এখানে আর কি দিয়ে সেপারেট থাকে? orbital tract থেকে থাকছে হলো ophthalmic artery and nasociliary nerve. Further forwards, reflected tendon, the superior oblique passes and the superior rectus. আমরা যদি এটাকে superior rectus বলবো, এই superior is just vanet cord. এটার উপর দিয়ে পিছনে চলে যাচ্ছে। কোথায় আসলো? Vanet the superior rectus to reach the insertion to the equator and superior rectus muscle. Laterally, the angle between the superior rectus and lateral rectus found the lacrimal artery and nerve. Remember this. Laterally, the superior rectus, this is the superior rectus, we know it, and this is the lateral rectus. Okay, this is the lateral rectus. These two rectus between it, আমরা দুইটা important structure পাই. These are the lacrimal artery and lacrimal nerve. Okay. Medially, ophthalmic artery and nasociliary nerve lie angle between the superior rectus, superior rectus, and medial rectus. And this is the medial rectus and superior oblique. Superior oblique এর এই জায়গাটাতে আমরা কি পাবো হচ্ছে ciliary nerve angle থাকে, এই যে ciliary nerve, ciliary ganglia, এই ciliary nerve এখানে থাকে, ciliary nerve and lie angle between the superior rectus, medial rectus, superior rectus. Insertion দিচ্ছি কোথায়? superior rectus আমরা বলেছি 7.7 mm. superior innervation কি দিচ্ছে? nerve supply কে দিচ্ছে? nerve supply দিচ্ছে superior division of the ocular কোথায়? upper 1/3 and lower 2/3, or middle 1/3 and lower 1/3. Okay. Into the under surface at the junction medial and posterior. Remember it. It is the under junction. So it is under surface. But inferior rectus is superior. That are inferior rectus. Inferior rectus is the strongest muscle. It is the shortest muscle out of the all rectus. Inferior rectus arises below the oblique foramen previously said from the annulus of Zinn, inserted 6.5 mm from the limbus. Inferior rectus also attached to the some fiber to the facial expansion to the lower eyelid. Blood supply দিচ্ছে medial muscular parts. It is 40 mm long, tendon 5.5 mm, and wide is 9.8 mm. Okay, this is the relation. See, previously we said inferior division of the third nerve. Third nerve is the inferior division. Third ocular nerve lies above the muscle. This is the inferior rectus muscle. This one. এবং এটা কোথায় থাকে? এটা উপরে থাকে। কিন্তু উপরে থাকে, নার্ভ সাপ্লাই উপর দিকে হবে। Separated by the orbital fat and lobe of the eye. Separated. Laterally, the nerve to the inferior oblique runs in front of the lateral border of the inferior rectus between it and lateral rectus. Inferior rectus এবং lateral rectus এর মাঝখান দিয়ে যাচ্ছে। Below, posteriorly এটা কি বলে? The floor of the orbit grouping the maxillary sinus. And this one is the maxillary sinus. এটা grouping করে থাকে. The muscle is contact with the orbital process of the palatal bone posteriorly, but more anteriorly is separated by orbital fat from the orbital fat of the maxilla. পিছনে posterior যে palatal bone থাকে, ওটাতে fat দিয়ে separation থাকে, and anteriorly by the maxilla. Remember it. This relation in MCQ exam. Innervation বলেছি আগে, inferior division of the oculomotor nerve, and কোথায় দিচ্ছে এটা? At the junction of the medial and posterior third, and the supplied by the upper sinus. And it's upper sinus. Okay. Now medial rectus. Medial rectus is the largest and strongest ocular muscle. Okay. Medial rectus origin নিচ্ছে কোথা থেকে বললাম? It is both upper and lower tendon থেকে in the annulus of Zinn. Upper third, upper annulus থেকে নিচ্ছে 2/3, lower 1/3 থেকে নিচ্ছে 1/3. Lower tendon. Insertion দিচ্ছে কোথায়? Equatorial anteriorly 5.5 mm from the limbus. Some fibers from here also attached to the facial expansion to the ligament. Blood supply দিচ্ছে inferior muscular branch of the ophthalmic artery and two anterior ciliary artery. size 40.8 millimeter long, and tendon is 3.7 millimeter long, but widest 10.3 millimeter long. Okay. This is the relation of the medial rectus. Above the medial rectus lies the superior. Okay, this is the superior oblique, and this one is the lateral rectus, and this one is the medial rectus. This is the medial rectus below and lateral rectus, and this is the superior oblique, and this is the nerve from the brain tissue. And this is the lateral rectus, and this is the lateral rectus. Just start করে দেখিয়েছি. This is the medial rectus, and this is the inferior division and lower division, and this is the inferior upper division. Okay, inferior upper division. These two divisions, upper division, lower division, and this is the ocular. Arises from the brain tissue. This is the midbrain. Okay. The ophthalmic artery, anterior and posterior ethmoidal branches enter the posterior ethmoidal artery, anterior ethmoidal and infracochlear nerves lies between the medial and superior. Medial rectus and superior muscle between the থাকে। তাহলে আমরা জানি ইথময়েড ফোরামেনটা কোথায় থাকে? ইথময়েড ফোরামেনটা থাকে ইকুয়েটর থেকে anterior যে lacrimal crest আছে তার থেকে 50 মিলিমিটার posterior in the orbit, এবং তার থেকে 10 মিলিমিটার posterior থাকে হলো posterior, তাহলে 25 মিলিমিটার or around 30 মিলিমিটার from the anterior posterior lacrimal crest থেকে এই anterior ethmoidal foramen and posterior ethmoidal foramen থাকে। তাহলে in between this relation below the medial rectus the orbital floor. Okay, medial to the rectus is orbital flap, and separated it from the orbital plate of the ethmoid bone, and as well as laterally the central orbital flap. Medial rectus is supplied by the inferior division. Okay, this one inferior division. This figure memorize inferior division, not superior division. Sometimes exam in MCQ both for FCS pass part or our written examination in the admission test. Medial rectus is supplied by the inferior division. Remember this figure. Okay, which enter the muscle on its lateral surface. Superior rectus below the surface, inferior rectus upper surface, and medial rectus the lateral surface. At about the junction, medial and posterior third. All of the medial and posterior third. That means anterior one third is free. Remember it when the squint surgery is done. The length of the muscle, and this length of the muscle is divided into 3 parts. When you excision of the muscle, then it is cut 2/3 and 1/3 in between this. If below the 1/3 and cut the nerve fibers and going to the paralysis. This is the backward paralysis. Okay. Now lateral rectus. Lateral rectus arises from the annulus of Zinn. Okay, we see previously said the lateral rectus upper 2/3 and lower 1/3 is the upper part of the tendon and lower part of the tendon. Lateral or external rectus muscle arises both upper and lower tendon. Those portion which reaches the superior orbital fissure. Remember, superior orbital fissure ke এইটা base করে থাকে. This is the another MCQ question for the MCQ's first part. Or the MCQ for the admission test. The origin said to assume from the letter U shape is to get the opening faces of the optic foramen. The limbs of U being referred to as the upper and lower head of the muscle. That means this is the muscle. You have 2 heads. It's the only muscle. two-head muscle is the lateral rectus muscle. Remember it for the MCQ axis. Inserted laterally 6.9 millimeter and blood supply inferior branch of the ophthalmic artery, that's lacrimal artery. Inferior ophthalmic artery by lacrimal artery. It is 44.6 millimeter long, cannon is 8 millimeter long, and 9 to 2 millimeter wide. Relation. Previously said in this picture, relation to আমরা বলে ফেলেছি. Then again, the structure go through the two heads of the lateral rectus within the bones of the muscle or within the annulus of Zinn, have referred to as the oculomotor foramen. This structure from above downwards at the upper division of the third nerve, the nasociliary nerve, the ophthalmic branch of the sympathetic fibers, and then the lower division of the third nerve, then the sixth nerve, and then the some ophthalmic vein. The sixth nerve is supplied by the another nerve. This is not supplied by third nerve. Hello, students, can you hear me? Hello?
তোমরা মাঝে মাঝে একটু কথা বলবা, তাদের সাথে ইন্টারাকশন করবা। হ্যালো, শুনতে পাচ্ছ?
Hello students.
তোমাদের ভিডিওগুলো অন করে মাঝে মাঝে একটু তাদের সাথে কথা বলবা।
Hello? Can you hear?
Yes, sir.
Can you hear me?
Yes, sir.
মাঝে মাঝে একটু হেলো টেলো বললো, না তো আমি মনে হয় করবো যে তোমরা শুনতে পাচ্ছ না।
স্যার একটা করে ক্লাস নিয়ে যাচ্ছে, বুঝো না? কিন্তু তোমরা যদি কষ্ট হচ্ছে স্যার, তোমরা যদি একটু কথা না বলো কেমনে হবে? কথা বলবো মাঝে মাঝে।
আমাদের যেটা ছিল, হ্যালো স্টুডেন্টস, ল্যাটারাল রেক্টাস মাসল। ল্যাটারাল রেক্টাস মাসল সাপ্লাই দিচ্ছে, কি বলেছি, all recti are supplied by the oculomotor nerve. Superior division, inferior division আমি ভাগ করে দিয়েছি কে কোনটা সাপ্লাই দেয়, but lateral rectus is supplied by the sixth cranial nerve. Okay, LR6. Okay, remember it. And which lies below the lower division of the third to the lateral in between the two divisions. Okay, now our two oblique muscles, superior oblique and inferior oblique. The two oblique muscles are recti group muscles. Unlike the recti group muscles, they do not originate from the common tendinous ring. তারা কিন্তু common tendinous ring থেকে origin নিচ্ছে না। তারপর থেকে নিচ্ছে from their origin, the oblique muscle take an angular approach to the eyeball in contrast to the straight approach to the recti. Recti গুলো নিচ্ছে straight আর oblique muscle গুলো নিচ্ছে angular insertion. And this is another question for the MCQ. They attach to the posterior temporal quadrant below the equator at the surface of the sphere. তাহলে ইকুয়েটরের posteriorly নিচ্ছে, পিছনের দিকে নিচ্ছে। কোনটা কতটা নিচ্ছে এই আমরা একটু পরে বলবো। This insertion, oblique insertion, not equator বরাবর insertion. And this is the oblique muscle. Okay, আমরা যদি এখন দেখাই, this is the equator. Vertically যদি দেখাই equator সামনের দিকে recti muscle, and equator পিছনের দিকে দিচ্ছে oblique. This is the superior oblique, this is the inferior oblique. You see this muscle inserted horizontally and this muscle inserted obliquely. Okay, remember this point. Obliquely, angularly. When in question in MCQ, this is the obliquely inserted. Okay, see, and this is the roof. Remember it, And two oblique muscles, and this is the inferior oblique muscle, short, just over here is the intra-orbital foramen, just in 5 millimeter below and 10 millimeter medially. But another question is the medially, that is the ligament set, and from there laterally, millimeter laterally, it is arises 1.5 to 1 centimeter. So 5 millimeter to 1 centimeter from the orbital rim থেকে original inferior oblique muscle. Okay. Axis of the oblique muscle. The oblique lie same oblique plane 51 degree medial to the optical axis. And now we know this is the optical axis. And this is the visual axis. Visual axis key. Optic থেকে optic বলবো মেকুলা থেকে যে ফোভিউলা আছে ফোভিউলা দিয়ে সেন্টার পয়েন্ট দিয়ে and target tissue যাবে সেন্টার অফ দি কোর্নিয়া থেকে visual axis. And this is the optical axis. Optic axis হলো যে posterior pole থেকে সেন্টার দিয়ে সেন্টার অফ দি কর্নিয়া দিয়ে এটা পিছন দিকে আসবে. The optical axis when we discuss the squint chapter, then we will discuss more. This is the 51 degree medial to the optical axis. Okay, and this is the visual axis. In adducted position, axis coincide with the optical axis. Remember it. তাহলে আমরা মনে রাখবো যে যখন এটা 51 ডিগ্রি যদি তারা মিডিয়ালি আসে তাহলে তারা কনসেপ্ট করবে কার সাথে অপটিক্যাল অ্যাক্সিসের সাথে. রিমেম্বার দিস পয়েন্ট. ওকে, নাও সুপিরিয়র muscle. Okay, it is longest and thinnest extraocular muscle. Origin arises above and medial to the optic foramen by a narrow tendon which partially overlap the origin of the lateral muscle. Lateral muscle থেকে এটা insertion হচ্ছে. Inserted trochlea at orbital ring on medial wall anterior, that is medial wall of the orbit on the frontal bone. Okay, ওখানে যা কি হচ্ছে যে পুলিটা হচ্ছে ট্রক্লিয়াটা হচ্ছে এখানে গিয়ে বলতেছে the medial wall of the orbit, anterior superior medial wall of the orbit on the frontal bone. The muscle stops just before the trochlea. The trochlea দেখা যায় তার নিচে দিয়ে তারা স্টপ হয়ে যায়. superior orbit muscle just তার নিচে দিয়ে 0.5 1 to 2 millimeter or 0.5 millimeter 5 millimeter below-তে এটা স্টপ হয়ে যায়. And then proceed to the tendon under superior rectus. Superior rectus in niche diye jay. Okay, superior rectus. Then process tendon under the superior rectus, posterior to the insertion of the under superior rectus, posterior to the insertion of the temporal aspect of the behind the equator. Equator is temporal aspect, not medial aspect. Temporal aspect. Temporal axis অর্থাৎ superior rectus and lateral rectus এর মাঝে below the equator oblique insertion দিচ্ছে. এই জিনিসটা মনে রাখতে হবে. ওকে, নাও আমাদের this is the superior view of the right hand. এইভাবে করি and this is tendon. Okay, and this is the another picture. Both eye. This is the superior oblique. Superior oblique, here is the pulley. This is the superior oblique, this superior oblique. Here is the pulley. Superior oblique on this side. Yeah. It is size 40 millimeter long. Tendon is 20 millimeter. That's cut hole 60 millimeter. Okay. And wide 10.8 millimeter. Innervates only the muscle as support, innervated as support, outer surface of the muscle. এই মাসলটা দিচ্ছে কোথায়? আমরা অল মাসল বলছি, বাকিগুলো কোন দিক দিয়ে দেয়? দুটা উপর দিক দিয়ে, একটা দুটা মিডিয়াল রেক্টাস ল্যাটারাল রেক্টাস এগুলো দিচ্ছিল ইনসাইড থেকে, ল্যাটারাল রেক্টাস দিচ্ছিল তোমার LR6 এন্ড এটা দিচ্ছে আপার সাইড ইনারভেটেড muscle becomes a tendon 1 centimeter posterior to the trochlea. Okay, তাহলে যে আমরা কি বলেছি ট্রক্লিয়ার নিচে, that is 1 centimeter, it's 10 millimeter. Okay, now trochlea about this little bit short note in view exam. Trochlea of the superior oblique is a poly-like structure in the eye. Trochlea consists of a U-shaped pitch of fibrocartilaginous part, not fibrous part. It is both fibrous and cartilaginous. Both. Trochlea is 5.5 millimeter long, 5.5 millimeter long, 4 millimeter high. Height is 4 millimeter. Deep is 1.5 millimeter long. Okay, 4 millimeter deep and 1.5 millimeter wide. Remember this point. Okay, this is MCQ question. And cartilage merges imperceptibly above with the fibrous tissue and is attached to the fovea or spina. Trochlea is on the frontal bone a few millimeter behind the orbital margin on medial wall of the orbit. The medial wall of the orbit and frontal bone corner. Immediately below the entering the pulley striated muscle joint pattern, which is enclosed in a synovial sheath, beyond which a strong fibrous sheath accompanies the tendon to the eye. Remember it. This short note repeatedly comes in exam. Now, think of it. Okay. 10 মিনিট আমি টপিক শেষ করে দিই। আমরা দুইটা ভাগে ভাগ করে আমরা লেকচার শেষ করতে চাচ্ছি। Can you students hear? Students, can you hear me? Hello, students. Jilani Jewel, can you hear? Okay. আমরা দুটো লেকচার শেষ করতে চাচ্ছি, কারণ হচ্ছে যে আজকে আমি তো গাইডলাইন দিয়ে দিলাম। It's an important lecture for the written, for the technical purpose, because in practice, invariably we face the muscle imbalance. Always written exam, biogram exam, and practical life, along with this school surgery or prosthetic surgery, orbital surgery. We just inferior oblique muscle, then stop this. Later on, next lecture we continue. Inferior oblique muscle, it is the shortest muscle. Origin কোন থেকে নিয়েছে আমরা বলে দিয়েছি। Orbital surface of the maxilla, a depression little behind the orbital margin, and just lateral to the orifice of the nasolacrimal duct. আমরা বলেছিলাম lacrimal sac এর নিচে থাকছে, lacrimal sac এ থাকে কি nasolacrimal duct, lacrimal মানে sac থেকে কন্টিনিউশন হয়ে আসে। It is length হলো 36 millimeter. A tendon is only 1 millimeter, and wide হলো 9.6 millimeter. Insertion দিচ্ছে passes backwards, পিছন দিকে যায়, সবগুলো যায় সামনের দিকে, এটা হচ্ছে পিছন দিকে যায়। এটা রিমেম্বারিং ফর দি এমসিকিউ এক্সাম। Laterally below the inferior rectus, the muscle and floor of the orbit posterior to the equator in the medullary area. Remember it. Medullary area, which is at the lower edge of the lateral rectus muscle, about 12 millimeter from the insertion of the lateral rectus muscle. Lateral rectus muscle থেকে 12 millimeter, remember. And parallel to the superior oblique muscle. Superior oblique muscle যেভাবে দিবে ঠিক এটা parallel. Posterior nasal end about 5 millimeter from the frontal nerve. Frontal nerve and over the macula 2.2 millimeter from it. Blood supply দিচ্ছে inferior branch of the ophthalmic artery and inferior canal. Nerve supply দিচ্ছে inferior division of the ophthalmic nerve. Only 6 minutes more relation. Near its origin, the lower surface of the muscle contract the peristeum of the orbital floor. Laterally, it is separated from floor by fat. Just before the insertion, the muscle this surface, which now faces lateral, is covered by the lateral rectus and canal structure. আমি ক্লাস নিচ্ছি পরে, হ্যাঁ আমি ক্লাস নিচ্ছি পরে। Just below, before the insertion of the muscle, this surface, which now faces laterally, is covered by the lateral rectus and canal structure. Remember it. The upper aspect contacts fat, the inferior rectus, then finally spreading out and becomes concave. It molds itself on the arm. Okay, up to this. Today, thanks everyone. Up to this, any question from student side? Please, students, any question? Hello, students. Hello.
কেউ কথা বলে না, এটা সমস্যা।
Hello, students, any question?
ডক্টর হরিয়ানা দি, আমি স্টুডেন্ট, কথা বলো। তোমরা যদি কথা না বলো তাহলে স্যারের ক্লাস নিয়ে কি মজা পাবে বলো, উৎসাহ পাবে? ফারিয়া নাদির আছো না? ফারিয়া নাদির?
জি স্যার, আসসালামু আলাইকুম স্যার।
হ্যাঁ, ফারিয়া কথা বলো, কোনো কোশ্চেন আছে তোমার?
হ্যাঁ স্যার, কোশ্চেন নাই স্যার।
হ্যাঁ, না থাকলে কেমনে হবে?
থ্যাংক ইউ স্যার।
বুঝো না কিছু?
ফারিয়া সব বুঝেছো?
জি স্যার।
বুঝেছো তো সবগুলো?
জি স্যার, জি স্যার।
সৃষ্টি
স্যার লিখে
সৃষ্টি আছো? সৃষ্টি
নিউ স্টুডেন্ট সৃষ্টি?
স্যার বুঝতে পারছি, সমস্যা হয় না স্যার।
ওকে, নাজমা, সুলতানা নাজমা, নাকি নাজমা সুলতানা?
নাই স্যার। এই শহীদুল সুমন,
না,
তোমার
স্টুডেন্ট তো
ডিও শামিম, ডিও রেসিডেন্ট শহীদুল সুমন, তোমার কোনো প্রশ্ন আছে স্যারের কাছে? বুঝছো তুমি?
আমি যে পর্যন্ত বলেছি তোমরা কি বুঝেছো?
জি স্যার।
নিউ স্টুডেন্ট শামিম
স্যার, আসসালামু আলাইকুম। জি স্যার, বুঝতে পারছি স্যার।
ওকে, তাহলে একটু এখানে কিন্তু আমি অনেকগুলো পয়েন্ট দিয়েছি যেখান থেকে তোমাদের ভিউ কোর্সে অবশ্যই কোনো না কোনো শর্টনোট পাবা।
জি স্যার।
নেক্সট লেকচারে আমরা এলপিএস মাত্র থেকে শুরু করব।
কেজি স্টুডেন্ট যারা আছে তোমাদের কিন্তু প্রশ্ন হয় কিন্তু এখান থেকে অনেক রিটেনে অনেক প্রশ্ন পাবো স্যার আজকে পড়ার মধ্যে থেকে। কেজি স্টুডেন্টরা একটু অ্যাক্টিভ হবা।
আমরা শুধু এখানে আমি খন্ড খন্ড করে ভাগ করে দেখিয়েছি। রিমেম্বার ইট, ভেরি ভেরি ইম্পর্টেন্ট। হ্যাঁ, এবং এখান থেকে এটা অত্যন্ত পছন্দের সাবজেক্ট প্রফেসর গোলাম আজাদ স্যারের। হ্যাঁ, যে লেকচার কালেক্টেড ফ্রম ম্যাক্সিমাম পোর্শন ফ্রম দি প্রফেসর গোলাম আজাদ স্যার and our respected teacher also, madam, sir, madam, so madam, sir, আমাদের also the statistics department a question papa, remember it. Okay, আল্লাহর কাছে যে আজকে আমরা এই পর্যন্ত শেষ করতে পেরেছি। নেক্সট লেকচারে আশা করছি পুরো যাচ্ছে আমরা শুরু করব। আমার এনাটমি একটু পরে শেষ হয়ে যাবে। আমরা প্রয়োজন পড়বে যদি আমার এনাটমি চাই, আমার রেজিস্টার চাই, তাহলে আমি নতুন করে রিপিট করে আবার শুরু করব, অথবা অন্য কোনো এনাটমি টপিকস
স্যার নতুন করে শুরু করলে ভালো হবে। আসসালামু আলাইকুম স্যার।
আসসালামু আলাইকুম। Thank you very much, sir. Thank you, sir. Thank you, sir. Assalamu alaikum. স্কুলটা তোমরা থাকো কম্পিউটার করে জয়েন করবে, তোমরা থাকো। আর স্টুডেন্ট সংখ্যা তো খুবই কম। ঘটনা কি, আমাদের ছাত্রছাত্রীরা কোথায়? আপনি আপনার প্রফেসর 25 জন ছিল। এটা তো খুবই খারাপ ব্যাপার।
আমি লাগিয়েছি, আমি পরিণয় দিকে লাগছে রেডি করা আছে, পরিণয় দিকে আমি ক্লাস ইমেজিং